channel with your gorgeous host, Kukua Asaneba. Good evening to you all and welcome to tonight's episode. It is on this show that we set to address issues that hinders our growth as youth. Remember, it's all about you. And tonight is going to be a special one-on-one edition with the newest member, or let me say the newest addition to the Youth Avenue, to the Watch TV channel. Yeah, not just the Youth Avenue. I'll introduce her to you very soon, but before then, I'd like to urge you, kindly subscribe to our YouTube page at Watch TV channel if you have not done so yet. And follow us on all our social media platforms, that is Facebook, Instagram, Twitter, and TikTok at Watch TV channel. And the program is sponsored by the Center for Volunteerism and Social Transformation, CENVAST. This is the Youth Avenue, and as I said earlier, tonight's episode is going to be a one-on-one interaction with a beautiful young lady who is so passionate about her job, in the person of Doctor Araba Odum, the newest addition to the Watch TV family. She's going to host a show called Health Moment. Doctor, you're welcome.
Thank you.
And it's been so great having you here.
Yes, I think it's been great joining the team too as well.
Oh, thank you so much for this moment.
Oh.
And the Health Moment is a big one, right?
Yeah, it's a challenge.
Wow.
Yes,
Okay.
but we hope to do something good
Wow.
once we've started.
Yeah, sure. Okay, so before we get into the health moment, I'd like to tell our viewers who you are. Tell us a little bit about yourself and your medical background.
Okay. All right. So I'm Dr. Odum, as Asaneba rightly said.
Yes, the ever gorgeous. Yeah, that's you. I'll transfer that to you.
All right. So okay, so I'll just start briefly with my education and then how I got here. So my primary education was in quite a number of places. I started, I think, in Takrady, went to Takwa, then came back to Takrady. I finished my primary education at Bethel Methodist School in Takrady.
Okay.
And then I moved on to the Archbishop Potter Girls Secondary School, which was also in Takrady.
Wow.
Finished my secondary education there. And then moved on to do my medical training in Ukraine for 6 years. Then after that, I came back to Ghana, wrote the licensing exam, did my house job, and then started working officially. Currently, I'm a general practitioner working in a private facility here in Takrady.
Okay.
So I think that's about it.
Wow. Okay, so how has it been so far? You practicing this health?
One thing I think every doctor will say, or every health practitioner will say, is you were really not trained enough for the field work, if I can put it like that, yes. I mean, when you're in the class, when you're learning everything, it's a book, it's like do, don't do, do, don't do. You understand, yes. There are specific things, you know, if you see this, but then when the person is in front of you, it's a whole different thing, because I mean, you're being trained on how their emotions are, how they're even going to respond to your suggestions and a whole lot of things. So I believe being in the field is not just practicing medicine, but it's just growing even yourself as a person. You get trained on how to deal with people's issues aside their health problems. Yes.
Okay. I mean, I find it a bit marveling sometimes, you know, sometimes what exactly we are taught in class is way different from what we go meet there. So when you get there and you don't know how to adjust yourself, you find yourself in a big problem.
Exactly. I mean, in school, they will tell you, okay, this disease, this is how it usually presents. But then most times patients will come and then they have like more than one thing they are presenting, more than one disease. And then you would have to figure out what is what and all of that. And I mean, in the end, you have to make a diagnosis, and it's not. Most times, it's not just one; it's a lot. So it's like you're always learning, you're always refreshing your memory. You always have to be, you know, on top of your game, so that you don't miss any diagnosis. Because I mean, one will definitely affect the other, and if you leave one out, it becomes an issue too. Yeah.
Okay, this is a personal question. Why is that always doctors' handwritings and all that?
Please, I have a very nice handwriting that is really readable.
Okay.
But most times, because we are in a hurry, I think it's developed whilst you're in medical school, because I mean, our notes are always a lot, your lectures are always in a rush, so you have to find a way to write so quickly so that you can make up the time.
Okay.
So I think once But of course, 6 years in medical, by the time you are done with the 6 years,
Yeah.
you would have gotten stuck to than highlighted. So it's not like all doctors. Some of us are highlighted very nice. So yeah.
Okay, right. Now let's talk about the health moment.
Okay.
What's your inspiration behind it, and then what do you aim to achieve at the end of the show?
Okay, so let me give you a little background on how I even joined the team in the first place. Yes. So I think I had to fill in for someone during a medical outreach. Yes, a colleague of mine, she was busy, so I had to fill in for her during a medical outreach. And that was when I met the director here.
Yes.
So he said, oh, the way I handle the outreach, the talk and everything, he would suggest that I come on set. He would try and train me to host the show. And personally, I'm not a very public person, so it was a real challenge for him trying to convince me. I know I gave him a really tough time.
Yeah.
Because I wasn't really interested in being out there. I felt I wasn't even ready to start presenting myself out to the public. So we kept going back and forth. I kept giving him excuses here and there. And then eventually I decided, okay, let's try the first show. I mean, the first rehearsal was something else. But then gradually with time, I mean, we built upon it, and then here we are now. My inspiration for it, so when he offered it, I mean, it was something that was in line with some of the goals that I have to achieve in the future. I plan to achieve in the future. What I really loved about it was he presented it with the Sustainable Development Goals.
Yes.
I mean, the goal number 3 talks about good health and well-being, the general well-being of the average person. So I liked that part when he started with the SDGs, I mean, because this is what we are all about.
Yeah.
We are doctors, but then we mean to improve the health of the average person. Yes. So when he brought it up, I was like, okay, that's a good avenue. And there are a lot of misconceptions that people are hearing here and there. So I said, okay, then let's try and see how best I can also help in this area. So that was how we started.
Wow. And that's what brought us here.
That's what brought us here.
Actually, thank you so much for agreeing, because this is very important. Issues of health, Charlie. Everybody needs it. Everybody needs it.
I mean, people are very interested in their health. And because of that, all these fraudsters are capitalizing on it to give the wrong information. I mean, there are lots of things that we see at the hospital. You know, that we just tell ourselves if the person had the right information, this shouldn't have happened. Yes.
Okay, Doc, so who is your target audience?
My target audience is the average Ghanaian. I mean, we are starting in Ghana, so the average Ghanaian. And then as we go further in life, obviously, it will be the average person. As much information as they can get about their health, we'll provide it for them.
So can you highlight some of the health issues that you'll be addressing on the show?
So for the average Ghanaian, me being a Ghanaian, I know the challenges that we face and then the issues that are quite common with us. So there are quite a number of diseases we hope to tackle that are quite common in the Ghanaian society. Example, hypertension, diabetes, how do you call it, typhoid, malaria even. Some of the cancers, breast cancer, for example, is really increasing in our setting now. Prostate cancer, yes. There are quite a number of things, but these are some of the diseases that we hope to tackle and tackle in depth. Try to break it down for the average Ghanaian citizen to understand. And then we'll also talk about the general issues on whether sometimes if we can, if our government is really doing right by the policies they put in place for our health, if the average Ghanaian is getting all they need to get paid, the national health insurance policy, if the health workers are also getting what they deserve, looking at how much they input into the job and all of that. So it's all the issue about health, be it the health worker, be the average Ghanaian, we tackle everything.
So then what do you hope for our viewers? I mean, in terms of their knowledge of their health and well-being.
So there's a fraction of Ghanaians who are quite literate, and there's the other fraction who are not very literate. We hope to break it down to the simplest level so that every person can understand, at least have a little knowledge about what goes on with their bodies, so that they don't ignore some symptoms and wait till it gets complicated before they come. And then to also for them to know how best to get access to healthcare once they find themselves not well or anything. So that's the information I plan to give to the average Ghanaian.
Okay.
To make sure that whenever you step into a hospital or you decide to go to a hospital, you know what you're about, and you know how best to present however it is you are feeling, so that the doctor can get the most out of it and give you the best that you need. Okay.
Okay, so Doc, are we to expect a panel or experts in your field who will be joining you on your show?
Of course, definitely. I'm a general practitioner now. I'm not specialized. So definitely when it comes to specialist topics, I would bring in specialists to talk to us. They will break it down for all of us to understand. When it comes to the, let me say, policy issues that has to do with your health and all of that, I'll definitely bring in a professional, because I mean, there's just a few I know. So I'll bring in a professional to help us understand how best to get the best for our health and from the country. And then, I mean, there are also all these legal issues that sometimes come up. I mean, for a while we were seeing a whole lot of medical legal issues, and then we will bring in some of these medical lawyers to also help us understand what we need to know, what we don't need to know, and all of that. Yes.
Okay, so when are we to expect your first show?
So this is the month of October, and then there's a topic that is, I mean, popular everywhere now in this month of October. So I believe our first show is ready to be aired tomorrow. We're going to talk about, as we all know, it's a pink October, so we're going to talk about our breasts and then how to get the breast assessments done, basically breast cancer. So expect me and our panel tomorrow.
We can't wait to have you, Doc.
I can't wait to share the production with you guys. I mean, you viewers will love it. And then I believe they will also understand a whole lot about the breast cancer. Everything they think, they know. If it's right, I mean, we would reiterate it. If it's not, then we'll correct the other myths that they also do have.
Okay. It's actually been great having you here to sit with you to talk about these issues.
It was nice being here.
And to officially welcome you. To officially welcome you to the family. I mean, we embrace you.
Thank you very much. I'm glad to be here.
So before we end it for today, what advice would you have for our viewers?
So for our viewers, what I would love to say is, once you join any of our productions, whether it's mine or Asaneba's, come open-hearted to listen. I mean, we want the best for you. Health Women's especially is to help you gain all the knowledge that you need concerning your health. If you have questions, we'll give you an avenue for you to post your questions. We'll answer your questions, and then whatever misunderstandings you have, we'll correct them to make sure that you have the whole package. So we are here for you as viewers. We hope you are here for us.
Yes, we hope you are here for us too. Thank you so much, Dr. Araba Odum.
You're welcome.
Thank you so much. And to you out there who stayed with us from the beginning, I mean, this session was actually a very short one, and we like it that way. Yes. So for you who stayed out there, we say thank you so much. Watch out for Health Moments. We would update you when it's coming and everything. So watch out. And please, if you have not subscribed to Watch TV channel yet, kindly do so. If you don't do it, you are going to miss out on a lot. So please do so, and follow us on all our social media platforms as well. Thank you so much. My name is Kukua Asaneba, your gorgeous host. Till same time next week, stay blessed, stay beautiful. Bye.
Watch TV, promoting sustainable development.